Peritoneal dialysis. First, we will see for the checklist for peritoneal dialysis. This includes we need one IV cannula, 20 gauge IV cannula, or 16 to 20 we can use, and we need IV drip sets and injection KCL. This is urometer. This is bio set or pediatric drip set. This is PD fluid, and we need syringes and sterile gloves, surgical blade, suture material, 30 suture material, and 3-way stopcock. And along with this, we need the major one is PD fluid, that is 1.7%, and need soda bicarbonate injections 8.4%, and we need heparin, and we need vancomycin. This PD catheter. So in pediatric age group, so we have trocar, and this is surgical blade, and this is PD catheter. Next, coming to what are the indications for peritoneal dialysis? So indication for peritoneal dialysis includes hyperkalemia, hyponatremia with volume overload, conditions like pulmonary edema and severe hypertension, pulmonary edema and severe hypertension, and persistent metabolic acidosis, hypocalcemia, hyperphosphatemia, refractory to medical therapy, then uremic encephalopathy. So these all are the indications for peritoneal dialysis. In dialysis fluid, we need to add potassium chloride 3 to 4 milliequivalents per liter, and heparin of 250 to 1000 units per liter, and soda bicarb of 40 milliequivalents per liter. And also add antibiotic, preferably vancomycin. Procedure for peritoneal dialysis. The first, we need to empty the bladder by catheterization. In this child, we already catheterized the child, and bladder is empty. Now we are cleaning with 3 swab technique, and after that we'll drape the abdomen. Now abdomen is cleaned and draped. Now we have to do the priming of the abdomen, that is by creating a fluid filled reservoir by infusing 20 to 30 ml per kg of dialyzer fluid into the peritoneum. So for that, we need to insert a IV cannula in the midline approach below umbilicus for installation of PD fluid into the peritoneum. Here we are using 20 gauge pink color IV cannula, the midline approach, infraumbilical area. So we are inserting with the zigzag technique. After insertion of the IV cannula in the infraumbilical area, now we have to connect the PD fluid, and we have to instill the PD fluid into the peritoneum. Now the peritoneum is primed with peritoneal fluid around 20 to 30 ml per kg. So that is, here we infused 20 ml per kg, around 200 ml of peritoneal fluid, PD fluid is in the peritoneum. have to insert appropriate size PD catheter. Is it trocar with PD catheter with a single bulb? Okay. Now for the insertion of PD catheter, we need to take skin incision, that is paramedian approach. The upper 1/3 and lower 2/3 of the right or left spino-umbilical line. Now this trocar cannula is inserted into the skin puncture site and it is passed through the skin underlying fascia. Entry of this catheter tip into the peritoneum is evident by the sudden loss of resistance and also by the appearance of the PD fluid in the transparent catheter. After placing catheter, ensure all serrations are inside the peritoneal cavity. Now adjust the length of the catheter by adjusting the bulb of the catheter. Now we have to connect PD catheter to the trocar cannula. Now secure the catheter to the skin with superficial pursing suture. Now connect this PD catheter to the three-way cannula in series. Now clean the surgical site and apply proper dressings. Now PD cycles carried out with dialysis volume of 10 to 20 ml per kg with dwell time of 30 to 40 minutes and fill time taking 5 to 10 minutes and drain time 10 minutes. Total duration of cycle around 60 minutes.